Bismillahirrahmanirrahim. Alhamdulillah wa salatu wa salam ala rasulihil kareem. Welcome everyone to ICNA Relief Health Series first webinar. My name is Rashma Khan and I'm the Director of Health Services and an OBGYN by profession. ICNA Relief USA is a multicultural human development and community building organization. The purpose of this organization is to address the basic human and social service needs of our underserved communities in the United States through its local chapters and its head office located in New York, Jamaica. As a vision and a value-led organization, ICNA Relief operates under the principle that all people are created equal and when given the tools will thrive and bring about change in their own lives and lives of the communities. ICNA Relief's mission is to promote justice through creating opportunities with family and people to lead healthy and productive lives. We have several programs, including 36 food pantries, 22 transitional homes, 8 health clinics, specialty clinics, as well as ICNA Relief has responded to about 61 disasters since 2001 nationwide. As we are all aware of the global crisis of COVID-19, it is a pandemic now. It is a time of uncertainty, time of fear, and lack of resources. We at ICNA Relief as an organization are rallying, taking steps to help our fellow Americans by providing home food deliveries, telehealth services, collaborating with local Department for Health for increasing testing for coronavirus, and organizing webinars with experts in medical, spiritual, and mental health fields for public education and to answer your questions. This webinar is the first in series of many to come in our health service department. Today we have 3 wonderful panelists who will be first giving a brief presentation on different aspects of COVID-19, and then we will open the floor to your questions. I will be moderating your questions and directing them to the appropriate physicians. So please, if you have any questions, you can type in the chat and send it privately to me, and I will be taking care of those questions at the end of the session, after the presentations. So first, let me introduce Dr. Tipu Khan. He is the Fellowship Program Director of Addiction Medicine and a core faculty at the Family Medicine Residency Program in Ventura County Medical Center in California. He is the Medical Director of Ventura County Street and Backpack Medicine Project and Assistant Clinical Professor of Medicine at UCLA. He will be discussing the epidemiology, the current statistics, mode of transmission, and preventative measures for COVID-19. Then we have Dr. Bilal Paracha. He is a diplomat in American Board of Emergency Medicine and Director of Education and Outreach and Wellness Center of Greater Texas ER Group. He will be discussing the current screening recommendations, ER protocols, and when and who gets admitted to the ER, what is the criteria for discharge of patients who test positive for COVID-19, and who do we admit in ER. And finally, we have Dr. Azmat Qayyum. He is a board-certified pulmonary critical care director of ICU McKeesport Hospital, University of Pittsburgh Medical Center. And he will be discussing the course of disease once the patient gets admitted to for COVID-19, the disease management, recovery rate, major cause of death, and his experiences in the ICU so far. So without further delay, we will start with Dr. Tipu Khan.
Thank you. So I'm going to go over a quick overview of where we are so we all can have an understanding of the current state of affairs. This data has been compiled from a few different sources. One of those is the Centers for Disease Control, also World Health Organization, and Microsoft Bing, which puts together a lot of different reporting sources into one place. So I'm going to go over a couple of facts by starting with a couple questions. So the first question we're going to address today is, where are we now? So currently worldwide, we have about 272,000 infections with a rate of about 11,299 deaths. That's a fatality rate of about 4.15%. Currently here in the United States, we have 18,121 infections confirmed with a death number of 233, giving us a fatality rate of 1.29%. So our fatality rate in this country is about 3% less than what we're seeing worldwide, but we also aren't able to test everyone as we should be. So these numbers are constantly dynamic and changing every day. Next question that comes up is, well, how does this compare to other pandemics? So a couple of big ones we want to look at. More recently in 2009, there was the H1N1 pandemic. And over the course of 1 year, that infected as many as up to 1.4 billion people worldwide. and killed between 151,000 to 575,000 people per the CDC. In the United States, the mortality rate for that was about 0.02%. So a huge difference. We're talking about anywhere from a 1 to 5% mortality rate with COVID, a 0.02% with H1N1. And that affected mostly children and young adults, and most of the deaths were in those under 65. The other big epidemic to compare this to is 1918 influenza epidemic. And in that epidemic, the current data and statistics looking back at it suggest that probably at least about 10% of people who were infected died, and probably about a third of the world's population was infected at some point. It killed around 40 million people worldwide. So the numbers of fatality we have currently for COVID still aren't as bad as the 1918 influenza that was at about a 10% fatality and mortality rate. So the next question I'd like to cover is, what's the difference? Well, we're learning more and more each day about the coronavirus strain. And what we do know is that most deaths are in the elderly over the age of 60, but young people are not immune from this. They are getting sick as well. Fatality rates vary between 1 to 4%, but again, because of adequate testing supplies being low, we don't know for sure. Next question I would like to address is, how do I get it? How do I get this infection? Well, remember, this infection is spread mostly from person to person through respiratory droplets, such as coughing or sneezing, or when someone touches their face after coughing, sneezing, they touch you, they touch a surface, you pick it up from them, and you spread it to yourself. People tend to be most contagious when they're most sick, but early in the disease, you may have no symptoms, and you may still be able to spread it. So we're still learning about this. And we're currently learning that the virus can live up to 3 days on certain surfaces. Well, how can you prevent yourself from getting this? First off, understand that many, if not most people, are going to actually get this illness. So probably about 50 to 60% of the population is going to get this illness during this course. And 80% of those that will get it are going to have mild symptoms like a standard cough and cold, nothing that's going to really wipe anyone out. The best thing you can do to avoid this is right now avoiding people. So everything we're talking about from a social distancing standpoint, crowds less than 10, no closer than 6 feet apart, etc. Work from home as much as possible if your work allows that. Clean your hands often. Soap and water is the best way to do that. Wash your hands with soap and water for 20 seconds. If that's not available, then go ahead and use a hand sanitizer that contains at least 60% alcohol. And if you use a hand sanitizer, rub all areas of your hands and make sure they dry completely before you consider them to be clean. Try not to touch your face. Stay home if you're sick. If you're going to cough or sneeze, cover your cough, cover your sneeze. After blowing your nose or covering your cough or sneeze, please wash your hands for 20 seconds and make sure you throw away whatever you used to cover that. Wearing a face mask is advised if you are sick. If you are not sick, there is no data right now to recommend everybody wear a face mask to prevent this, unless you are caring for someone who is sick and that person can't wear a mask. So we are not recommending the general population wear a mask right now unless you're sick, or unless you're taking care of someone who's sick and they can't put a mask on themselves. And the best thing you can do is going to be to clean and disinfect frequently touched surfaces at work, at home, to help prevent contact and spread. Thank you.
Thank you so much, Dr. Tipu Khan. That was an amazing, good presentation for us to get the basics learned and to reiterate our regular screening precautions of the transmission precautions and how to keep ourselves safe in this environment. Next is we bring up Dr. Bilal Paracha, who's going to take us to the next level as to, okay, how are we doing in our ERs? What is happening in the ERs currently? What are we seeing there? And how are we deciding which patients are going to stay and which patients are going to be discharged? And once they are discharged, we also would like to know as to what instructions we are giving them and what are these patients coming back to the ER with the similar symptoms, and what is your experience? So Dr. Bilal.
Alhamdulillah Rabbil Alameen, wassalatu wassalamu ala ashrafil anbiya wal mursaleen, bismillahir rahmanir rahim, nahmaduhu wa nusalli ala rasulil kareem. We'll begin in the name of Allah, the most merciful, the most beneficent. So first of all, I would like to thank ICNA Relief for arranging such a wonderful webinar on the overall creating awareness about COVID-19 situation. Thank you for inviting me to be part of the panel. Really, it is an honor. So first, I hope that everybody is having a good time or trying to have a good time while together in homes, confined, and using it as a proactive opportunity to reconnect with ourselves, to reconnect with our families, to reconnect with the books, to reconnect with our faith and with our Lord. On a lighter note, you would have seen multiple social media jokes saying that the parents will create vaccine sooner than anybody else if schools remain off. So just, but again, take it very seriously, all the precautions. It's for us, whatever has been told, as Dr. Tibu Khan particularly mentioned all. So now, number one thing, I would like to divide in 3 phases: pre-ER, ER, post-ER. So pre-ER, we are all in the pre-ER phase. What we need to do when in that situation. So the 3 things: fever, cough, and shortness of breath. And it is not one of the 3 things, it is all those 3 things together: fever, cough, shortness of breath. That is sort of indicative of having symptom with possibly COVID-19. Again, it's a wide spectrum. Most of the time, it is just common cold, flu-like symptoms. As multiple studies have shown, 84% of the time, it is mild disease. And in many patients, they may have not even diagnosed or may have not even come to the medical attention because of its low severity. So when do you need to go to ER? So I will tell you that what we are told as physicians, the patients to send back home. So, and that I will again touch when we reach in the ER phase. So anybody with the mild symptoms, which means low-grade fever, cough, even fatigue, rhinorrhea, and sore throat. So you can all remember having flu, sometimes it can look pretty bad, influenza. So, but any of those symptoms without any warning signs. And what are the warning signs? So warning signs can be shortness of breath, difficulty breathing, hemoptysis, which means throwing up blood, and increased sputum, and without any chronic underlying conditions. So those patients, we will be advised to send back home. So if you are having the mild symptoms and no shortness of breath, no other like these warning signs, so you are good to stay home. What you do if you feel like that, no, you have to get the medical attention, medical care, I will suggest to have numbers handy. For example, there is national CDC line, number 1-800-232-4636, CDC info. But that is like sort of obviously very busy at this time. Try to have your local numbers, local county health lines, and they can help you find out what, if you meet the criteria or not to go to ER. So that will help a lot. If you think you need to go ER, again, call ahead, tell them so that they are ready to receive you with all the precautionary measures taken in place. What are the precautionary measures? Once now we are entering in the ER phase, and here I would also like to address if any of our participants are worthy physicians and particularly ER physicians. So they say that I will reach to the protective PPE, protective gear, which consists of 4 things, but I was just reading in detail in the CDC, they are saying that may be the least effective. So the most important thing is the whole system, that once the patient hits the door, if it is already pre-screened, already isolated, taken into a separate room. And again, negative pressure is no more a recommendation. The physicians will understand more what I'm saying, not a particular requirement, but an isolated room, separate restroom, that is a requirement. And then particularly in inpatient, have the dedicated staff. So all those things will help develop a system where those patients can be taken in isolation and then somebody can see them. Next will be that what are the protective gear? This will be 3 Gs and 1 M. Gloves, gown, and goggles. Gloves, gowns, goggle, and then mask. Again, mask situation, N95, a lot of, like panic, even the general public receiving and buying that. So it is in short supply, but we can use any mask if we do not have N95 and respirators. They are recommended, they are preferred, but if we do not have those for any situation, any mask. So those things will be important to start with for the ER doctors and for any healthcare professionals. After that, hand sanitizer, hygiene. For the healthcare professionals, it becomes much more important. Make sure that we sanitize, we wash our hands, wear gloves, and then see all patients, because any patient can be potentially a presentation of COVID-19, and wherever we suspect, we immediately go to all those four things: gloves, gown, goggles, and mask. After that, so as I mentioned before, if there are the mild symptoms, so low-grade fever, cough, just like rhinorrhea, which means that a lot of sneezing, runny nose, even fatigue, but there is no shortness of breath, no coughing up blood, no increased amount of sputum, no underlying disease. So all in that situation, those patients will be sent back home, and now we will enter into the post-ER phase. So post-ER phase will be 2. Now, if any of those warning symptoms come up, if any patient is really sick with all that respiratory situation going on, so that what will be the inpatient side, and Dr. Qayyum will touch on that. I will quickly focus on the home care. So the home care will be that the patient should be in isolation. Most likely, it is recommended that this is the family members are there to take care of him. He's not on his own, or she is not on her own. Then there is a separate restroom if possible, and then there is protective equipment is available for the family to take care of the patient as well. What will be the supportive treatment most of the time? Again, in the pre-ER phase and the post-ER mild symptomatic patients, the symptomatic treatment will be to keep yourself well hydrated, but not too much fluid. They say too much water, too much juice, just that will be, so excess of anything is bad. Number 2 will be Tylenol, or it's like Panadol in other countries. That is mostly recommended. About ibuprofen or Motrin, Aleve, there are some studies from France which have been published in one study published in Lancet journal that tells that ibuprofen can be dangerous or can be causing further damage in this situation. So try to avoid that. So that will be our pre-ER, ER, and post-ER phase, as I mentioned, and we will further discuss in detail. I would like to quickly end, and I know Dr. Khan told me specifically, but I would like to quickly, she told me specifically to remain in this topic. But one more important thing is that our immune system, that is our biggest help in all this situation to fight back. And for immune system, the recent studies are showing that the stress and anxiety can be the biggest lethal thing for the immune system itself. So, and that what they say that the stress disrupts our connection between immune system and the neurologic system. And what it causes, it can reactivate even multiple viruses, and it can reactivate many latent infections. So remain calm, no panic, keep balanced and keep focused. Inshallah, things will be all right, but follow all the guidelines, and we will further discuss in the questions. Thank you very much.
Thank you so much, Dr. Bilal. Jazakallah khair. So very important point that you touched on is the how to strengthen the immune system. That is a very, very important point, because at this point we are all in panic and stress and anxiety, and especially with a lot of uncertainties. There are people who are worried about the jobs, worried about what's going to happen in future. So yeah, that's a very important point that you touched on. Thank you for doing that. Our next panelist is Dr. Azmat Qayyum. We welcome him. Dr. Azmat.
Okay, Assalamu alaikum. Thank you very much, ICNA, for arranging this webinar. And Dr. Bilal, that you touched actually the most important part, that how to stay calm and stay home if they can. So once Dr. Bilal decides to admit patient to the hospital because patient looks sick, and what are the signs that patient needs to be admitted in the hospital would be if a patient is hypoxic, like needing oxygen, and patient is short of breath. And we should just remember those patients who are going to come, they are not going to come with just COVID-19. Those patients could have underlying illnesses like COPD, heart disease, and renal failure. Those are patients who are in the age group of, from any age group, but 40 to 80 years old. So they are coming with this infection. Now their symptoms are going to be significant, including hypoxia and with fever and shortness of breath. And some patient could be more sick. So from emergency room, they decide where patient is going to go. Is he going to go to the hospital, regular bed, or patient is going to go into ICU? When patient gets into the regular bed in the hospital, the most important thing is how to get patient very isolated into a room which is isolated, and all the staff is using protective gear. That is actually key. This is creating panic in the hospitals right now, that how we keep those patients isolated, and how we're gonna conserve the rooms and the ICU beds, and if patient need ventilators. So that's why all this care is, and all this education has been given, that we stay, follow all those guidelines so that we don't get sick and we don't spread it. Anyhow, patients who are in the hospital in a regular room, we treating them with oxygen, with fever Tylenol. Some patients may need higher amount of oxygen. Some people may need a BiPAP. So we keep them in a step down or in a hospital floor. And if patients get too sick where they are not able to maintain their oxygen and they need more support of like a ventilator, they go into ICU. And the patient in ICU who are going, usually they have more like underlying illnesses like COPD or liver disease or kidney disease or heart disease. So patient management in ICU is also the same, like if they are intubated, we follow all the protection is the key, so that the staff is protected and we are not spreading that. And the management is still at this point supportive. Fortunately, there are recently, just today, came from France that hydroxychloroquine and azithromycin has shown some promising results. Actually, if it seems too good to believe, but if it is good, that is going to be great. That in 10 days, we can, actually in 6 to 10 days, we can bring that complete cure, which is hard to believe, but that's very encouraging. There are some other medication which are under trial, like remdesivir, and then lopinavir and ritonavir. Those are the medication which we use in HIV patients. They were in trial, and actually we just learned that they were not that effective. So now at this point, there are several investigational drugs are being used, but up till now, hydroxychloroquine and azithromycin combined together has shown some promising results to bring the viral load down and to make a faster recovery. So what is the major cause of mortality? Actually, mortality in those patients is mainly depending on the age of the patient, their underlying comorbid conditions like heart disease and COPD. And fortunately, it is still not very high, actually. Patients are recovering and going home, and it depends on what are the other comorbid conditions they have. And from our data, what we have in United States, the mortality is like 1%. But what striking thing is that the adults are not safe from that. We had about 20% adult population from age of 20 to 44 who were also admitted in the hospital. But fortunately, most of them recovered. And so recovery rate is pretty good. That's very encouraging. Other thing is, fortunately, I do not have a personal experience in my hospital. So we are keeping finger crossed. But my sister hospital, there are 2 patients and both were recovered and sent home. So at this point, we are all praying that we keep number down in our area. And if we follow all what we physicians and this medical community and even government is trying to do, hopefully we can keep that curve flattened and we can prevent more admissions to the hospital and more sick people. Thank you.
Thank you so much, Dr. Azmat. And so main points that we learned from Dr. Azmat was that there are 2 main new medications that are coming out that was being given out by France, hydroxychloroquine and Zithromax. And also the good thing that he said, the mortality rate is not that high that we're seeing here in US. So now we'll open the floor to questions. And please, if you could type your questions in the chat box, that would be greatly beneficial for us. I see 2 hands raised. Is Ziv Lang? Could you please type your question in the chat box? Okay, so we have a question here. No, I think it was an accident. Okay, next is Abir. Okay, so I'm not able to see any questions so far. Okay, there is another question by Abdullah Zakaria. He says, with face masks and low availability, can we use bandanas or niqabs? So let me ask this question to Dr. Tipu Khan.
Sure. So that's a very good question. So again, going back a step, face masks are only recommended if you are a healthcare provider or if you are sick. So if you're a regular person out there and you are sick, you're coughing, sneezing, you should wear a face mask. Or if you're taking care of someone who is sick, but they can't wear a face mask for some reason. Otherwise, we're not recommending the general population wear face masks because there's not enough quantity to go around. The CDC did put out a recommendation earlier that you could use in a healthcare setting a bandana for healthcare providers who are having shortages of obtaining masks. But we're not sure if that actually is recommended because we haven't actually studied that. So the answer to your question would be right now, the best thing you can do actually is, unless you have symptoms, not to wear a mask and save those masks for people who need it, healthcare providers, people who are sick. But if you had to use one, you could use something like a niqab or a bandana, but they're not going to provide the appropriate micron coverage to prevent a virus from coming in 100%, but it would be better than nothing. The flip side, the thing to remember in that situation is if you use that, you have to make sure that you disinfect that, right? So you've got a cloth now that can hold this virus. That's a porous surface, meaning that virus can live inside of it. It can live there for up to 72 hours. So the flip side is if you do that, you need to remember to go ahead and wash that in a proper fashion, hot water, soap, etc.
Thank you. The next question we have is, I've heard sauna might be effective. Is this true? I think Dr. Tipu, you can take this one too.
Sorry, I missed the question.
So I heard that sauna might be effective. Is this true? This question is by Mr. Rashid.
Sauna.
Yeah.
No, there's no data right now that sauna is effective. The heat that you get in a sauna is anywhere from 105 to 125 degrees, depending on where you're at. But there's no data that heat is enough to kill the virus. If it were hot enough to kill a virus, it would probably kill the cells that are living on you. So unfortunately, no, the sauna would not be effective.
Question to Dr. Bilal. What would you suggest for someone in their late 40 to 60 that has to work with public?
Yes, so that will be like, I would say myself and all those people working, and I would like to pay tribute to the healthcare providers from all of us together who will never be off. And I was thinking, Dr. Tipu Khan was saying that work from home. I was thinking, how about when my patients show up in the ER, I send a message, okay, I'm working from home, tell me what's going on. So as they said, once the pilot said, here is your pilot, I'm working from home. So obviously, and everybody cannot work from home. So in that situation, we need to be obviously, again, on a balanced side. Just see where we are, what type of work we are doing, how much social distancing we can keep, how much interaction or other patient, like touching others is needed. For example, again, in healthcare professional, you have to touch others, so make sure we wear gloves. In other situations where we do not have to shake hand or we do not have to touch, we keep our distance as much as possible. Again, if we are sick ourselves, we make sure that and sick means any flu-like symptoms. If we can stay home, wonderful, but if we have to work, we must wear gloves. Continue using sanitization and hand hygiene. it's like more focus has been on the masks, and I'm hopeful it is coming back into the right place. So most focus should be on our hands. Washing hands before eating, washing hands after using restroom, using sanitization, and like as much less possible touching surfaces, touching doorknobs, touching elevators. Yesterday, I got a message. It was pretty important that there is a concern that gas stations may have been sort of like a source of the infections. So when we are going there putting gas ourselves, we use some napkins, something like that. So again, most focus on our hands, and hand hygiene does not mean continuously washing hand, because that will be another extreme. It means as much as we can save and don't take our hands to our mouth. So I think that would be the way to go. Thank you.
Okay, and next question, Dr. Bilal, to you as well. How long or how often does one need to disinfect any clothing that is used to protect others from getting sick?
Again, I think there is no particular guidance in that regard, and Dr. Qayyum and Dr. Tipu Khan can add in that regard if they have more information. But it's sort of like if our clothes come into close contact with any other surface, with any other person, then there is a risk of having some droplets on that. And washing it one time should have been good enough. There is no particular time limit to disinfect.
So as we have learned that those droplet aerosols kind of stay around for 3 hours, and then we have seen that virus can be viable for 72 hours on different surfaces. So if we have those whatever we are wearing, it's best to kind of get that cleaned on a regular basis. If doctors or physicians are using scrubs, obviously that should be cleaned every day. And the same way, if like I'm wearing a shirt and a tie, I should definitely, for it could stay on, the virus could stay on for 12 hours on your clothing. So that's why you should get that clean.
Okay, so the next question, I think again to Dr. Tipu Khan. How can one be contagious while not showing any symptoms of corona disease virus?
That's a really good question. Part of again, we're learning a lot about this as we move forward, but part of what happens when you get any infection is what's called an incubation period, where the virus is in your system and it's starting to replicate and make you sick. And so there is what's called a window period. There is a period of time where you can have this virus in your system and not really have a lot of symptoms, but it is replicating, so you could shed it during that time. But the way you would shed that virus, the way you would be contagious still, is it has to get into some form of liquid. You have to sneeze, cough, or touch your saliva and spread it. So yes, there is a period of time where you might not have symptoms or have very, very mild symptoms and have the disease. But as long as you're maintaining appropriate hand hygiene and standard precautions we're talking about today with good hand hygiene, washing, etc., you would minimize your risk of spreading that to people in your house, family, friends, etc.
Okay, Dr. Bilal, next question for you. How to differentiate between a pollen allergy and COVID-19?
So I think in this situation, fever, we keep in mind, fever is a differentiating factor for having an infection versus any sort of like just allergies. So again, fever, cough, and then shortness of breath, those three things together. So there's pretty possible that with pollen allergy, you are having shortness of breath and cough, but most likely, I mean, obviously you should not have fever. And Dr. Qayyum is a pulmonologist, so he may put more light on that.
So, that's a very good question, because a lot of calls we are getting so panic in the hospital, you wouldn't believe that. Patient comes with the regular cardiac cath this morning, and on X-ray there was a little infiltrate, and they are now holding the cath, not doing a cath and calling to get checked. So there is a panic mode everywhere, actually. So just on that, the feeling of being sick and tired and fatigue, that is a very key symptom for this infection. Whereas if you have a pollen and allergies, you won't be feeling that sick. Like you have a little bit runny nose, little bit watery eyes, but you're not going to feel like completely wiped off, like tired. So that is usually like the same symptom like influenza, where people are very exhausted. And in this condition, that is also a symptom like fatigue and tiredness. But the other symptom like a dry cough, which usually you don't get with pollen allergies as much. And then as Dr. Bilal said, fever will be the key differentiating factor. And interestingly, some patients actually also come with GI symptoms, a small percentage. So it's not that clear that who have it and who not. That's why everybody's getting anxious.
One interesting question that we have is here, we know that chronic medical conditions like diabetes, high blood pressure places you at higher risk of developing the more intense COVID-19. But what if you have controlled high blood pressure? Does that still places you at a higher risk? If your blood pressure is under control and you're doing fine on medications, is this still place you at a high risk?
For infection?
Yes. Like comorbidities, any kind is a high risk factor for the disease development. So what about controlled blood pressures?
I don't think that put you at a higher risk. You know, the diseases which primarily affect your immune system, like diabetes, renal failure, some sort of cancer, or some other immune disorders, they put you at a higher risk to contract that infection. But just somebody having hypertension, even that is controlled, or even sometimes uncontrolled, that still doesn't reduce your immunity. So I personally don't think that will put you at a higher risk.
And I wanted to add just one thing in there that's interesting. We don't know the answer to this yet, but we need to keep a close eye on this, is the way this virus attacks the system is through an enzyme called angiotensin converting enzyme. And that's how this virus, this family of viruses, latches onto the body. We are theoretically thinking that some blood pressure medications like lisinopril, losartan, ACE, and ARBs, they might actually potentiate the infection or make it harder for the body to fight off the infection. We don't have any evidence or data to say that you should stop your blood pressure medicines because of this, but do keep an eye on this, talk to your doctor about it as time goes on, because as we learn more, we may make some recommendations and changes to medications. But as of now, as Dr. Karim said, you continue what you're doing, but do keep an eye on this as time progresses.
Sure. So this is a common question that has been asked, and as ICNA Relief, we have been putting out a lot of videos and also social media posts about our grocery distributions. So there's a lot of concern about this distribution, and someone wants to know, like, when people are lined up to get these groceries, how do you propose the volunteers should proceed so they are safe and the other people are safe? And do these volunteers need to go and sanitize their clothes once they reach home? Maybe Dr. Bilal?
So yeah, I think again, I would suggest that hand sanitization will be most important key here. Maybe just like continue washing, keep your hands clean, wear gloves at that point. Have clear, whenever we are trying to not having a distribution situation like this, maybe drive-through type picture where like we have our ICNA Relief truck is standing there and people are just driving through and giving boxes. And then we have clear instructions whenever we announce about that please, if you are having any symptoms like that, do not come there and go through this procedure. If you are having symptoms, you have to come, wear mask. ICNA Relief also, I would like to tell everyone, is doing home delivery in their respective areas, most of like particularly in Dallas, as I know, and I'm sure at all other places where they have the food pantries. So all those things will be important to tell the public that they do not put themselves and others at risk. But if obviously the volunteers in particular, it will be very helpful to when they go back to completely wash themselves and wash their clothes. As Dr. Kayoum mentioned, that virus can be there on the clothes for a while.
Next question, Dr. Sibu Khan, is what people have asked is the effect of virus in pregnant women.
Yeah, that's a good question. In pregnancy in general, pregnant women are considered to be slightly more immunocompromised. They are a higher risk for general infections like influenza and other infections. We don't quite know what COVID does in pregnancy as of now, but we think that it's probably right around the same level of morbidity. There's a group called the Society of Maternal Fetal Medicine, which is a group that is a high-risk specialist in obstetrics, and they are actually working on a potential guideline for managing COVID in pregnancy. So as of now, we don't know. We do know generally pregnancy puts you at higher risk for more serious complications of an infection, but we don't know any specifics yet about COVID specifically. But Dr. Reshma Khan can also chime in on this one as an OB-GYN.
Yes, and I agree with you, Dr. Khan. That's pretty much the same answer, same information at CDC as well, that the pregnancy just in general puts you at higher risk of being getting infections with flu, or that's why we recommend that every pregnant patient gets a flu vaccine. So same thing with COVID. There is no particular data that shows that there is increased risk to the baby versus increased risk to the pregnant mom. It's just the same as in regular pregnancy for flu virus. The second question that many people are asking.
Sorry, can I add one thing to that?
Yeah, sure.
There was a recent study that came out that is interesting that looked at, in China, looked at presence of antibody or viral replication and antibody positivity in babies that were born to moms who were confirmed positive, and found that it wasn't found in the infant. So we also don't know quite yet if it crosses the placenta.
And also breastfeeding, they were not sure that there are only few indications where breastfeeding is contraindicated, and this is not one of them.
Yeah, and I would also like to add in that situation that the pregnancy itself will not be a reason to get admitted in hospital if you go there. So again, if you have other warning symptoms, which we have mentioned before, then that would be the reason to admit, and that patient should be admitted at a place where there is OB/GYN and fetal maternal care is available. And again, as mentioned, like in multiple studies, it has been very kind to the kids so far, and no increased risk has been noticed in pregnant ladies even during delivery so far. Thank you.
Also, a repeated question that is being seen, and I wish we all had answers for that, but I can, maybe direct Dr. Asmit to you. How long this is going to last?
So that's a very difficult question, but what we are learning from, learning mean what we have got a little lesson from Italy and, from China, that we have to be very aggressive with this approach, what we are like lockdown approach. If we do that, we might get very lucky and we don't get to that level which it got to Italy, so that hopefully it will not last long and we kind of flatten the curve, and then kind of it just slowly kind of we get through.
Yeah. So basically saying social isolation and practicing the distancing is the key to make it go faster and help it and not prolong it for a longer period of time.
Yes, so that we don't get sick and don't get that. But yeah. Your question was not like how long it lasts when we are in the hospital.
Yeah, nobody, no.
Yeah, okay.
Yes. So another question is that, does COVID-19 present as anything else other than the respiratory symptoms? Like, do you think that abdominal pain, vomiting, or diarrhea could be the initial symptom of COVID-19? Dr. Bilal, because you're an ER physician. So.
Sorry, can you repeat the question? I was just looking at all questions.
No problem. One has asked that, do you think that COVID-19 just presents with respiratory symptoms, or it could have a different presentation like abdominal pain, vomiting, or diarrhea? Could that be the first presenting symptom?
So again, it's like sort of wide spectrum. It's most of the time like from mild side, cold flu-like symptoms up to pneumonia and respiratory failure. So that is like a wide spectrum. Most important things there to focus will be fever, cough, shortness of breath. Along with that, GI symptoms can be present, and basically that is like one of the warning signs that if you are having like fever, shortness of breath, cough, plus the warning sign if that you are having nausea, vomiting, and diarrhea, thing like that. So that will put you at a little higher risk. But GI symptoms themselves alone not most likely are the indication of COVID-19.
Another question, because Dr. Bilal, you had talked about this, and they say like vitamin lysine, it's written as lysine, but I don't know if we meant by lysine, is being advertised to strengthen the immune system, and doctors and nurses have encouraged the same. So is there any proof for this?
I don't think so that any particular proof for any of all those recommendations, which are like sort of the products coming up so far. These are all like different just recommendations. But my focus will be again, and I would like to bring here a question which I just was seeing to, it was a question who all a sister asked that my kids are very scared, what should I do? This is really, I wrote at some point in some group, there were like somebody posting a lot of things. I said, I think this panic will kill us quicker than the virus itself. This is a very serious situation, I would say, that we are so much, and particularly when sitting home, we are so much focused on all the news, all the social media. There is some like website and people are sharing like each and every minute the numbers, that how many cases have been like appeared in the world, how many deaths. So this all is really going to affect our immune system. And again, as I mentioned, studies, and there are multiple studies which we can talk about. So the most important thing, go back to basics. And as some of you may have watched my videos, so I did mention there that this is the opportunity to go back to our basic things which have been told by all faiths, and particularly as Muslims, that early to bed, early to rise, good eating, good sleeping, obviously, like then our keeping ourselves clean, and then have faith and do everything in balance. So that will be the thing, really, sort of strengthening our immune system. Thank you.
Yeah, and also to that effect, we want to just let everybody know that we are having a special webinar on the mental health counseling and how to deal with the social anxiety and the fear that is coming up. And at the end of this webinar, we'll be sharing that screen about that upcoming webinar soon.
You know, I'll just add one more thing on this thing. Now schools are off and kids are home. And I would recommend that parents should watch that kids are getting sleep. Because when we don't sleep, that's when our immune system goes down. And that's when we are most vulnerable. So it's for everybody that we get good sleep and continue to do exercise. That will definitely help us, our mental health and our immune system. So make sure we all sleeping good in this time. And that will raise our immune system than any other medication proven.
Yes, I would like to add here, and as we have been talking in our home also, to follow a specific routine. So good sleep may not mean sleeping in. It means that we sleep in time and we wake up in time, and then go through a whole routine thing. Like we get up, get ready. If we don't have to go out online studying, whatever, and then specific breaks, then reconnect with ourselves, as I mentioned in the beginning, our family, excellent golden time. That also, again, we can mention many studies how it helps our immune system, and disconnect ourselves as well from the social media, because I was just reading that the European countries, they have asked Netflix to slow down its streaming, because otherwise the whole internet will break down. So because we are just sitting and sort of like all connected. So disconnect ourselves, reconnect with our surroundings, and follow a specific routine. That would be very helpful overall, inshallah.
I just want to remind everybody, I see a few hands raised. Please, if you could write your questions in the chat, it would be better, because I'm not able to unmute you. So if you could just type your questions, that would be great. Second, one more question was like, will a diabetic have different symptoms or worse symptoms than someone who's healthy? Dr. Tipu?
So the symptoms themselves are going to be similar between a diabetic and someone that's not a diabetic. What changes, though, is being a diabetic does make you immunocompromised, which means that your body is at higher risk for having complications. So the general COVID symptoms, cough, fever, shortness of breath, that's probably going to be the same, maybe a little bit stronger than someone who was not a diabetic. The bigger concern, though, is then that can progress to what we're seeing, which is more of the severe pulmonary symptoms. So the pulmonary failure, the ARDS, these types of pictures that we're seeing from very sick patients, you are at higher risk from that in and of itself. But the symptoms that you would want to identify to present to a physician, to come say, hey, I need to be checked out, are going to be the same. cough, fever, feeling tired, muscle aches. These are all the symptoms and shortness of breath being the hallmark one. These are all the symptoms you should present. But I think the take-home point in this question is that if you are immunocompromised, diabetic, elderly, on immunocompromising medications for like lupus or rheumatoid arthritis, if you have a fever and cough, you should be one of the first people that presents to your physician, either by phone if your clinic is doing a telephone system, or to an urgent care or emergency department in person for evaluation.
Thank you so much. I think just as a brief recap, what we learned through this webinar was basically a few things here, that the fatality or the death rate of this infection is about 4.5%, which is less than the influenza rate, which is about 10% previously. The virus lives on the surface for about 3 days. And the best way to prevent the spread of the disease is social isolation, taking care of your basic hygienes. If you have mild symptoms, please stay home. The ER is already inundated with a lot of patients that are coming in. Those mild patients, even if you go to ER, they're going to send you back. So make sure that you follow all precautions, home isolation if you have mild symptoms. Also try to call a local county hospital before going to the ER to see if you really need to go there. The second basic question is N95 mask is not a requirement for general public, so don't panic about it and don't buy all those masks, because those are better to be used by the healthcare physicians. Treatment of the disease is symptomatic, and now the new studies to take ibuprofen is not recommended when you have all this viral infection going on. Better to take Tylenol. Most important thing is to strengthen your immunity, and for that decrease your stress and anxiety level. Relax. Everything is in Allah's hand, and this is ultimately this is the qadar of Allah subhanahu wa ta'ala, and what is decreed will happen. Have trust in Him, and continue with your faith. Increase your tazkir and your astaghfar. The second thing is the only reason to admit you in ICU or the state warning, if you have warning signs, would be good reason to go to ER. And if you have those warning signs and you would be admitted for ER, for ICU, the main reason would be shortness of breath. And there are no two new medications that are coming out, that is azithromycin and hydroxychloroquine, that are still under testing, but they show like a better outcome for so far. And all the things that we discussed, like pregnancy, as well as the well-controlled hypertension and diabetic symptoms, are not. They might have more high risk, but nothing different. And with that, inshallah, we will end this webinar series. And we thank you very much for joining us and being a part of this. Would like to share our two more upcoming webinars. If Sister Jasmine, could you share on the screen? So we have two tomorrow on Saturday, March 21st at 3 p.m. We have a spiritual webinar with Sheikh Yasir Birjas, Sheikh Walid Basyouni, and Ustad Bissam Sharif. There might be light fundraising after that. And then after that, on March 22nd at 3 p.m. would be the mental health webinar, which is from crisis to opportunity. And Dr. Marwa Azab, she's a very good speaker. I would highly recommend everybody to join this webinar and learn from her. So these are the two upcoming webinars, and with that, inshallah.
Sorry, Dr. Khan, can I add a few more points? So one thing I would like to again say here, that let's use this all anxiety in a positive way, and ICNA Relief is giving a wonderful avenue and opportunity to everyone that we become the helping hand in this situation. So we are like sort of developing our systems of delivering the groceries to the people who are in quarantine, the groceries or food to the people, elderly people, or even those of our neighbors, friends around who have lost jobs and they need help. So if we become that helping hand in this situation, that is the real positive thing which as Muslims we have to do, and which will again help us to keep our focus on the positivity rather than negativity. And I would like to request if other panelists may, if Dr. Reshma Khan's permission, may want to have some concluding remarks.
Like if Dr. Asmat, would you like to end with concluding remarks?
No, I would definitely get this opportunity to, thank you to, organize that and kind of run that. And ICNA, especially in these tough times, they are doing to educate the public and then helping hand to support people. So I would request everyone to support ICNA so that we can help people in this need.
And I would just like to add one last thing that this really is going to be, I think, the trying time of our generation. Other generations have had World War I, World War II, large-scale test of society. This is our test right now. And I just want to remind us all as community members within our own communities to please make sure to look out for each other. We have neighbors that don't have access to food because it's being hoarded. We have friends that don't have access to certain care. So while following the recommendations from your local public health agencies and what you should be or shouldn't be going and doing, try to reach out and look at the neighbor to your left and to your right and make sure that they're doing okay. Maybe tonight, maybe tomorrow morning, just knock on the door for the neighbor to your left and right, ask if they're okay, if they need anything, and maybe that we can propagate that action across society, because at a time like this, if we don't look out for each other, no one else will.
Wonderful experience that you gave to all of us, the knowledge that you shared with us. And as the ICNA Relief tagline is, spread kindness, not corona. So remember that, yeah. And keep us in your du'as, we'll keep you in our du'as. And also, if we would love to have a feedback from the participants. So if we would send out a survey to you, please fill out that survey so we can learn how to make our next webinars better, and we will learn from your suggestions. And inshallah, we will keep working on to get you better webinars every time we go along. So inshallah, thank you, Jazakallah khair for everybody being here and helping us out. Thank you very much. Jazakallah.
Assalamu alaikum.
Thank you. Assalamu alaikum.